I'm going to talk to you today about other sort of crossovers in the sort of work that I'm involved with and some of the work that you do, putting it into a policy context, but also talking about where our campaigns have the potential to intersect. So we do a lot of policy work. We're interested in enforcement of existing laws and law reform. We're advocating strongly for a tax on sugary drinks. We've got more friends in the room these days around that issue. It's becoming a lot more mainstream with the UK announcing they're going to adopt a tax. And last week we had the Committee of Presidents of Medical Colleges also calling for a tax on sugary drinks. So certainly the momentum's building. We've been involved with the dental groups for some time. In 2008, we made a complaint. Oh, sorry, I've kind of gone through that, but I'm worried that I'm going to run out of time. So I have to really try and stick to what I'm going to say. I mustn't go off-piste. So this is an advertisement that was put in the press, I think in 2009 or 2008. Kerry Armstrong, Mother and Mythbuster. We were concerned about a number of elements of this. Dental health was outside of our remit, but we thought it was concerning that they'd said it was a myth that Coca-Cola rotted your teeth. We were concerned about it was a myth that makes you fat, and we also ended up, we were also worried about the it's not packed with caffeine claim as well. So we wrote to the Australian Competition and Consumer Commission, who then investigated this issue. It was some time ago now, so the evidence has built a lot more around obesity and sugary drinks, but it was enough that the ACCC felt that this was potentially misleading and deceptive. So Coca-Cola had to take out corrective advertising. If it happened now, they would be fined a huge amount of money. As a result, they've also had to put all their advertising through their head office in Atlanta. And it was very embarrassing for them in the public domain. They got a lot of bad press, as did Kerry Armstrong. When she sold her house a couple of years later, the headline in the Domain, when they did editorial about it, was Kerry, the myth-busting mum. So that kind of haunted her for quite some time afterwards, and I think it was a real reputational risk for her, and it was certainly not very good for Coca-Cola's reputation either. And all the dental information in that work that we did in the complaint to the ACCC was done with the Australian Dental Association. So there was a professor in Queensland who put together a paper around black cola drinks and dental health, so that they were found to be potentially misleading around that particular thing. So that was the first time we started working with dentists, and it was very successfthis, and we were very pleased with what happened. And the Lancet also picked up that issue around, so there was an editorial in the Lancet. So this corporate behaviour was also had a light shone on it by a really eminent journal, including this myth-busting campaign. And there are other corporate activities around marketing and promotion. And the final line in this is, if industry continues on its present trajectory, the public's opinion of big food is going to follow that of big tobacco and decay as quickly as a Coca-Cola drinker's teeth. Recently, we've made another complaint to the Australian Competition and Consumer Commission around high-sugar toddler products, and in particular Heinz Shreds, which have now been taken off the shelf as a result of the announcement by the ACCC that they were taking action. These are very high in sugar, and I'll show you what the ACCC's concerns was, but you can see the vibe. These are for 1 to 3-year-olds. They're in the packaging, 99% fruit and veg. They look really good. And the ACCC was very concerned about the 99% fruit and veg claim down the bottom here. On the back, it says made with 99% fruit and vegetable juice and purees. These tasty treats are a fun and convenient snack for toddlers on the go. You know, they're inspired by our nutritionists who are also mums. Again, we're getting back to this mum myth-busting kind of, mums keep on coming up. And you can see here what's in it, 68.7 grams of sugar per 100 grams. I mean, these are really high sugar products. And in our complaint to the ACCC, we got a paediatric dentist, we had a paediatric dietitian, and we put a really strong case together. And this is going to the federal court now. Heinz are fighting it. This is a really important case because it's about these high sugar products directed to children. And we're developing a further complaint around lunchbox products for primary school age children. We're very concerned again about these high sugar products. So that's about us and the work that we do. Very slow, very long term, but it can be very impactful, and I think there's already been a bit of a chilling effect on the economy, on the industry around this kind of action. Just moving away, some of the other work that we're involved in is a collaboration of partners. Here's the ADA, Dental Health Services Victoria is here, and this is a collaboration of mostly national groups, but Victorian Aboriginal Controlled Health Organisation as well, and it's our Rethink Sugary Drink campaign. And we started it off with advertisements from New York, and we didn't have a dental focus, but we've moved on now, and we do try and carry a dental theme as well as other chronic diseases. And it's a fantastic website, fantastic resources, and it's a really powerful collaboration. And they've also, all the groups have united, the national groups, around a consensus, including calling for a government to investigate a tax on sugary drinks, calling for controls around marketing and advertising of high sugar drinks, that kind of thing. And it's partly designed to counter industry being a part of the solution. We want public health groups who are best placed to talk about public health to be out there talking to the community and talking to policymakers around what should happen. So I'm just going to show one of the ads that we've done with the Aboriginal community who are very active in this space. This example here, this is one of the people who works at our Quick campaign at the Cancer Council, and we've done some really fantastic work around sports drinks, so gammon, go for water instead. So that's one of our recent messages. Oh, sorry. I'm not sticking to my slides, this is really bad. But this is what the call to action that sits behind the campaign. So, and we're calling for, we want all workplaces, healthcare setting and other public places not to have sugary drinks. Fantastic not to see a sugary drink vending machine out there, because I have been into a lot of health services where that is just the par for the course. We're really concerned about exposure of children to sugary drink marketing, particularly through kids' sport. That just should not be happening. That's really wrong. Again, investigating taxes, and we want a social marketing campaign around the health impacts of sugary sweetened drinks. Oh, so this is one of our fabulous infographics. My husband's in the Navy Reserve, and he's just had to have quite a lot of dental health checks. I don't want to put you on border patrol on a ship and you have a dental health problem. So he said everywhere he went, these sugary drink infographics from the campaign he saw were up in the Navy dental services and their health services. So this stuff is getting out there, which is really important. This is very engaging, very simple, and you can see that, we're talking about tooth decay and erosion, we're talking about how much people drink, how much children consume, that kind of thing. And this is a really fantastic way to engage with the public, and we get lots of downloads and lots of tweets and lots of sharing on social media. It's really brilliant. So now, finally, I've got to the advertisement.
Now we're playing some good football.
You wouldn't eat 16 teaspoons of sugar in one hit, would ya? So why do we drink it? Auntie Anne at the health service said all that sugar would make you put on weight and make us sick, Mum, with like type 2 diabetes, heart disease, kidney disease, and even cancer. It could even rot your teeth. Hey, go with water instead. It's too deadly.
So we've got no money to do paid advertising, but we have done advertising on NITV. We've also had this showing during the Aboriginal football series, the VFL football on the screen. So we're trying to, get as much free coverage as we can. But this kind of marketing should be on television. It should be mainstream. There should be money to run these kinds of campaigns. But the Aboriginal communities really picked this up. It's really great to be able to do something for this community, and they're very much engaged and involved, which is really brilliant. Is it up to me now? Yeah. Okay. So I am based at the Cancer Council. I do lead the Obesity Policy Coalition, that's true, but I also work to manage the Live Lighter campaign for the Cancer Council. That's a government-funded campaign that has been running for, I think, a couple of years now, and it's was started in Western Australia. It's running in a number of states. We're trying to create a national brand, and it's been delivered by Cancer and Heart, but unfortunately the funding's been removed. But I'm going to talk to you about some work that we've done around focusing on sugary drink consumption. So the first tranche of advertisements was about trying to change behaviour, encourage physical activity, encourage people not to buy snack foods. And the second round of advertising was around sugary drink consumption. And I'll show you that ad. But a lot of the work was also done with health professionals in the community so that when the advertisements were run, they were ready to deal with the community's response to the ads so that they could support and help people to change their behaviour, which is one of the things we're going to talk about today. So this is the sugary drink ad that we ran.
Sports drink, fruit drink, energy drink or soft drink. The sugar in any sugary drink is sugar your body doesn't need, so it gets turned into fat, including toxic fat, which can lead to cancer, type 2 diabetes and heart disease. Breaking a sugary drinks habit won't just reduce fat around your waist, it will reduce toxic fat around your vital organs.
So that's an advertisement that mirrors the Every Cigarette's Doing You Damage ad. The first round of advertisements had an impact on attitudes, but it didn't impact on behaviour. This second round of advertisements had an impact on behaviour in high consumers of sugary drinks. They reduced their consumption. That is really significant that we've seen a change in what people drink. People are very responsive to this message. It's such a pity that this campaign isn't still going. The Cancer Council Victoria is taking it over, but we don't have enough money to continue to run paid advertising unless we partner with others. But you can see the potential to support communities who may already be activated around sugary drinks, getting them out of their schools, getting them out of their sports settings and things like that. And there is opportunity. This is an advertisement from Western Australia. This was put in bus stops, including outside McDonald's, who made a complaint to the Heart Foundation and the Cancer Council, who are running this campaign. We call that the scream factor. If industry complain, we know it's probably a good thing. That's all the evidence you really need. And you can see a lot of the partners here are similar to the Rethink Sugary Drinks. So there's Rethink's on there, OPC's on there, something called the Parents' Jury, which is now called the Parents' Voice. There's the Australian Dental Association. This combines advocacy together with a public message, and I think that supports policy reform because you are softening the ground for people to understand sugary drinks are a problem and we need to respond in a number of ways, including making policy change. And I just think that's quite a powerful image, and I would expect that more and more we will be moving into that more tobacco control model where we're not just providing education, but that we're really trying to get policy, regulatory change and really sort of engage with the community a lot more. So I think that's a really interesting model going forward. So thank you very much.